This program is a paid commercial announcement and in no way represents the views of WPH.D or its management.
Talk Radio 1210 WPH.D, WPH.D HD, WOGL HD3 Philadelphia. Now, Health Watch, featuring Dr. Molly FANTASIA, the PH.D. doctor and founder of Innovative Medical Associates, with valuable information that could help you improve your quality of life. Now, Health Watch, and your host, John Damazzi.
Good morning, Happy New Year, and welcome to the show. And let's see if we remember how to do the show, Dr. Molly.
Well,
I mean, it's been a couple of weeks.
John, it may be a couple of weeks, but you and I both know we know how to do the show.
That's right. We never forget. We can wake up at 3 in the morning and do a show.
You better believe it.
But anyway, good to have you with us as always. First show of 2022. Hope you had a wonderful holiday season. We certainly did. And we have, as always, plenty to talk about here on the show, which we call Health Watch. And, of course, the goal of this program, as it has been since we've been on the air, is to help you and your family improve your overall quality of life. And we do that with the one and only Dr. Molly FANTASIA, the PhD doctor, the executive director, and the founder of Innovative Medical Associates, Marlton, New Jersey. We'll talk about the who, what, when, where, why, and how of Innovative Medical. And yes, we'll talk about that 5-letter word beginning with a C. We'll talk about that.
John.
Well, unfortunately, we kind of have to talk about it. Whatever you want to talk about, though, is the answer here on the show. 855-839-1210. That's our number here in the studio. If you have a question for Dr. Molly, 855-839-1210. Hope you had a good holiday, Dr. Molly.
I did, John. And I really want to send out unbelievable New Year's greetings to all of our listeners and my patients who've helped me have a good year. And, you know, a blessed year to everyone, John. A blessed year.
And people have said in the clinic, I've been there over the holidays, and people said, you know, you guys sound like, you know, you really enjoy what you're doing and what you're talking about. And
I enjoy my work,
exactly.
And you enjoy your work.
That's
and
right.
I think the combination really shows, Sean.
Absolutely. So, again, 855-839-1210. Let's start the new year as we did in the old year.
Sure.
Talk about what Innovative Medical Associates is, what it does, and how it can help people.
Yeah, I think it's more important than ever to really start out like that, because hopefully we have some new listeners. So Innovative Medical Associates is actually a cooperative of medical providers, healthcare providers, who are like-minded. We work out of a licensed medical facility, which is Associates in Preventive Medicine. And so we can do anything a primary care facility can. Our physician, my medical director, can order anything that you would normally order in a regular primary care setting. So if you need a test, if you need some drugs, if you need whatever, we can do that. But we're lucky enough to actually share the philosophy of the least amount of pharmaceuticals to actually reverse or control a problem, and augment those with natural substances, vitamins, minerals, amino acids. And why we want to do that is we want to reduce the side effects of the pharmaceuticals that many times cause more problems than the condition itself.
And I was just going to say, the reason that you do that, I know this from doing the show with you for 20 years. I mean, the reason you do that is because of the potential side effects for prescription meds.
Right.
And often what happens is a patient gets a prescription, and then that affects them one way, so they have to get another prescription to take care of the effect of the first prescription.
Listen, it's a brand new year, and I want all my listeners out there to watch TV and see all the new prescriptions that are out now, and then hear all the disclaimers. It's unbelievable, right?
Right.
I mean, and look, I'm not saying you don't throw away your pharmaceuticals. We know they have a place in modern medicine. What we want to do is possibly limit the amount you need to control an issue and protect your quality of life. And that's really where we're coming in. We want to preserve your quality of life no matter what stage of life you're in.
And I know, Dr. Molly, last year, just about in every initial consultation, you got the famous question, Dr. Molly, we hear you on the radio. It sounds wonderful, but does the nutraceuticals and those kinds of things that you use, does it work?
I would say in 99% of the cases, it does work. Now, we're always going to have an outlier once in a while. We might need to tweak our recipe, so to speak, to help it make better for you. But yes, and can I prove it? Sure. Come on in on any Tuesday and start talking to our patients. Come on in on any Tuesday or Thursday. Start talking to a lot of our patients, and I think you'd find it very interesting because they themselves will tell you. But in addition to that, I think we can see some quantitative data to support it. For example, we can see a reduction in the blood sugar numbers. We can see a reduction in the lipid numbers. We might even see a reduction in the pain scale for patients. And the proof, I believe, is in the pudding. But I think it's important, John, to say, yeah, you can pick these substances up at a health food store. And I have a health food store gentleman who owns a health food store, is very knowledgeable. But what I would say is, that's the luck of the draw, depending on what product you pick up. So we've decided that hydration is the best way to deliver these nutraceuticals.
Because it's directly into your into your bloodstream, right?
Correct.
It's right in.
Right in, and we really have noticed over the last 25 years. Can you believe I'm going on 26 years?
26 years.
And
you never thought that, did you?
No, I didn't.
You figured that this would work a couple of years and then you'd retire, right?
Well, no, I didn't think that. I didn't think that, John. I was praying. I really was praying that people would understand that this is a better way to approach many of their chronic conditions, and I think that we've found that that's true.
And you know, what was I telling you before the show? Because everybody's talking about COVID now, and everybody's concerned about catching things. And I said to you, you know, I feel like the vitamin C and the drips that I get, you
Right.
feel it working because I feel like a little tinge maybe of maybe a cold, and it goes away within a day maybe.
Well,
so
as I said to my lovely Linda, let's not spit in the wind. You know, God has a lot to do with that,
Right,
and
right.
I believe that. You know, here's the thing, John. We still have to protect ourselves. We have to really improve the God-given immune system. That's really my belief, which is one of the reasons why I believe hydration in our particular clinic helps along those lines. But I'm also telling you, look, if you're a diabetic, don't throw away your insulin, all right?
Right.
Let's make the insulin more effective. That's what we do. We want to make your own body more effective to both the prescription drugs, to the natural substances, and to other things, quality of life, good nutrition, etc. So there are lots of reasons to approach our health in certainly in this year, this new year, utilizing some of God's ingredients.
And we should also mention, for those who may be listening for the first time, you started this 26 years ago because you had a personal medical challenge.
Yeah.
And you didn't like what they were
offering.
Right.
And of course, things have progressed. But nonetheless, you see that all the new progression in terms of medicine, listen, all you have to do is listen to the pharmaceutical companies. And by the way, folks, they're pretty smart. They're buying up a lot of the nutraceutical manufacturers. So it's becoming progressively more difficult to really navigate yourself through the world of natural substances. That's why a place like ours comes in handy.
All right, we are coming up on our first break of the morning. Our show is Health Watch, and you'll find us here every Sunday, 8 till 9, here on Talk Radio 1210 WPH.D. Dr. Molly Fantasia is here. She is the Ph.D. doctor and the executive director and the founder of Innovative Medical Associates, located in Marlton, New Jersey. You have a question for Dr. Molly? You have a medical challenge, and maybe over the holidays you said, my New Year's resolution is to get healthy. Well, you picked the right place to call in. 855-839-1210 is the number. 855-839-1210. With Dr. Molly Fantasia, I'm John DeMasi. We return. More of today's Health Watch after these words. And we're back here on Health Watch. As always, when we do the show, operators are standing by at Innovative Medical Associates. And you can contact them right now at 856-489-0505. And you might be saying, well, when I call, what do I ask them? Ask them any question you like. And the best thing you can do is to make an appointment to sit down with Dr. Molly. The initial consultation is complimentary. And again, that number is 856-489-0505, 856-489-0505. Someone in Dr. Molly's clinic the other day asked me, how can I listen to previous shows Well, it's simple. You go to Dr. Molly's website, innovativemedicalassociates.com, innovativemedicalassociates.com. You get a lot of information on that, including previous radio programs, if you'd like to listen to get some pointers on some things that maybe you missed. innovativemedicalassociates.com, innovativemedicalassociates.com is the website. And, of course, our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. The number here in the studio, if you want to talk directly to Dr. Molly right now, 855-839-1210. The elephant in the room, huh?
Oh, John, the elephant in the room.
We
You
can
know,
talk about this.
you know what? I feel like for the last 2 years, we have done a lot of shows on COVID.
Yes.
And unfortunately, even during this last year, and particularly this last month, we are inundated with COVID challenges and COVID questions. And I don't know about you, John, but I know you are on other stations and you are on other shows, and I bet you get a whole lot of data about COVID,
Tons.
right? And what you think is the underlying issue right now?
I really don't know, except people have asked me, and I've asked the same question, like, when is this going to end? One of your patients yesterday said, the other day, said to me, 2 years of this.
Right.
So the question is, when is it going to end? Is the vaccine working? And what are you saying?
Well, here's what I'm thinking. First of all, I want people to know that I must have read about 35 citations in the last couple of weeks about how to COVID test, when the COVID test, which tests are good, which are bad. I've listened to many experts. But, you know, Linda and I were working on Sunday this past week, the week before, last Sunday. Linda and I went into the clinic last Sunday because we needed to prepare several things for the onslaught of patients that we were having coming in for what? COVID testing.
Yes.
And so when we were talking there, I actually had the opportunity. I got a call from two very good friends of mine who actually live in Florida, but they are very well-read PH.D. Psychologists. And in talking to them, they were both on the phone. They're a husband and wife team. They have just written a citation about this fear that has, plagued us with COVID. So I said, well, Dr. Diana and Dr. Sam, you know what I think. Dr. Molly thinks. And she said, what? And I said, here's what I think. I think that the mental health issues are as bad as the symptoms of COVID. And she laughed. She said, she said, Molly, you were always brilliant. But she said, you nailed it right on the head. I said, the fear is causing an onslaught of a lot of symptoms. If you have a nasal sniffle, you think you have COVID. And my God, these at-home test situations are causing it to be worse. Now, through the last year, we have helped COVID people. I'm not saying we've cured COVID. We haven't treated so-and-so COVID. We've helped people through the symptomatology of COVID. And in fact, I believe that we saved 2 lives over COVID because we caught it early enough to see a COVID pattern in the chest. And Dr. Testa and I said, this guy's got to go to the hospital. Yes, he took some of our treatment programs. And I believe our treatments helped him actually get through the COVID situation a little quicker. But we're not dumb. We sent him out to the hospital.
I remember that story.
Yes.
Yeah, I do remember that.
So, is COVID as bad as we think it is? I don't know. But I know one thing, the PCR test, and we're contracted with a wonderful company. It's a private laboratory with very, very high standards. I spoke to both the medical director and the laboratory director, and we use a PCR test to confirm what we get in our rapid test, which, by the way, is better than 90% accurate.
Let's talk about, actually, you closed on Friday because of your...
More regulation, but more importantly, I want to keep our patients safe.
Right.
So, I had a situation where a patient who has cancer, I am very hesitant to stop treating someone because if you go to the hospital, they won't take you if you have it. And,
right.
And you're not sick enough, okay, in their mind. But, we also has to be really careful. If the patient comes in with symptoms of COVID and they tested positive for COVID, what do I do in a situation like that? Well, I segregate them, probably a bad word to use, but I do. I segregate those patients, keep them by themselves and away from other patients. But in this particular case, this woman refused to listen to me when I spoke to her that the coughing had to be kept in her, she had to be in her mask, and she had to cough in tissues and not spread it all over my clinic. Well, after one or two coughing episodes, I really got to a situation where I said, look, I think you'd be best treated at home. Take what I've given you in terms of, we have a COVID protocol that includes vitamin C, zinc, etc., some other things, some pharmaceuticals as well. I said you'd be best served taking the kit, going home, and keeping in touch, and I did keep in touch with her daily. But I really can't have the clinic exposed. So based on that, I closed down again to clean up the place. But the point I'm making is this fear level is out of control, John. Do your listeners say?
Yeah, absolutely. But how many times have you had patients get tested and then say to you the next day, I want to get tested again?
Well, that's crazy. You were there when somebody did that.
Yeah.
I said, please, do me a favor. I don't know. Is 3 days enough of symptoms to test? I'm reading data that says that. I'm saying other data that's saying you better wait 5 days. Well, and then we have the CDC saying, well, we used to quarantine for 10, now we quarantine for 5. What's real? I would say somewhere between 5 and 10 is
right,
probably
7.5.
Right, is probably real. But here's the thing, folks. The most important thing is what? We're going to go back to what you said. What do we need to do? Maintain our immune system.
Absolutely.
And even if we get it, God forbid, if we get it, we can get through it. And I've had several patients, including a whole family, who we help get through it and get through it fairly well.
So you have protocols to help if you have COVID.
Yes, that include, again, I'm going to say that include pharmaceuticals as well as the nutraceuticals that we all know work, including the zinc, including things like melanorin, including things that are antiviral, that are natural. But I would tell people, let's be prudent. If you can't breathe and your oxygen level goes down to below 95 or 94 or out of the 90s completely, guess what? Get to the hospital. But I have no control over the hospital, whether they'll take you or not. I mean, I've had patients who were turned away. So, you know what? We help them the best way we can.
What can you say to people who say, Dr. Molly, I don't want to get COVID. I mean, what can I do? And I think you've said it, the immune system,
Come on
right?
in. Let's tune up your immune system. Let's address it directly. And again, I would tell everybody, we really work hard at keeping our facility COVID free. And I think that we've all gone over the top now with this new variant. Look, folks, this is a flu, this is a virus, and I believe we're going to have to learn to live with this thing. So I don't know, John. I mean, I'm not the most brilliant bulb in the pack, but it would seem to me that we would do more now than ever to maintain our own immune system.
And that's really kind of the bottom line of this whole thing.
I think so. I think it is. And to really continue to keep our minds free of all this fear that's out there. My belief is, look, we're all in God's hands. I'm not saying you ignore, this is not snake oil what I do. I don't think we ignore the symptomatology, but at the same time, we got to stop jumping off roofs. I mean, I've never seen anything like this. Have you? And
no,
we're a couple of people who've been around for a couple of pandemics.
Right.
I mean, but I remember the old SARS that we had back in the early 90s. I remember things like that. And even then, we didn't become so emaciated in the fear. But I think the fear has been brought up by what? The media.
There you go. That's
right?
exactly right.
The media. And so, I'm a firm believer that I don't take my health and take my health for granted. And I certainly don't jump down the lane of every newscaster's opinion. I'm going to seek out true science and physicians' opinion.
So it's a good idea to come into your facility
and
start
become
getting
a patient.
right,
Become a true patient.
as a preventative measure,
right.
at least.
But guess what? That's going to entail a little bit of time commitment on your end because it isn't one and done.
Right.
And you know that because it isn't holy water. And that's what I like to say.
Not to spread fear, but I just got word a high school classmate of mine passed away.
Oh, yeah.
Of
COVID.
Yeah.
Well, here's the other thing, how many people are truly passing away from the complications of COVID or complications from comorbidities that they didn't address?
Right. That's
right?
exactly. That's what I thought too.
I
Because
mean,
the word was, this is what he passed away from, but I'm thinking to myself,
did he have diabetes?
Exactly,
Did he have a cancer?
exactly.
Did he have autoimmune? And that's why a facility like ours, John, where you come in every week and maybe twice a week many times, you see people, right?
Yes.
And they look better. They look better.
Yes, they do. Yes,
and they
do.
feel better, and they'll tell you that how they're feeling. And that's all I can say. If we do it right, I believe we can prevent us from having a lot of the complications that COVID entails.
Okay, we are at the halfway point of the show. That means you still have plenty of time to call in, and we told you last year, we'll tell you again this year. 855-839-1210 is the number. Call in so that when you call later on in the show, it's like we have 2 minutes left of the show. We can't really talk to you. So call in now. Call in early. 855-839-1210, so we have plenty of time to talk to you. That's the number here in the studio. The show is Health Watch. Sundays, 8 till 9, Talk Radio 1210, WPHT. Dr. Molly Fantasia is here, the PhD doctor and the executive director and the founder of Innovative Medical Associates, Marlton, New Jersey. With Dr. Molly, I'm your host, John DeMasi. We're coming back. More of today's Health Watch after these words. Welcome back to Health Watch. Operators, as always, are standing by at Innovative Medical Associates. And the number is 856-489-0505. 856-489-0505. They are there right now. If you have a question, or most importantly, you want to sit down and make an appointment with Dr. Molly to see her and really discuss your situation. And, of course, the initial consultation is complimentary, but that's really how you can find out a lot of stuff. You can. So all you have to do is call and make that appointment, 856-489-0505. 856-489-0505. And remember the website, innovativemedicalassociates.com, innovativemedicalassociates.com. A lot of good information on that as well. You could check it out at any time, innovativemedicalassociates.com. And our show is Health Watch, Sundays 8 till 9, Talk Radio 1210, WPHT. Again, our number here in the studio, 855-839-1210. You've often talked about this, Dr. Molly, subclinical doses.
Yes.
So
of pharmaceuticals.
Of pharmaceuticals, yes.
Right.
So
wouldn't
what is this about?
Wouldn't I talk about that because it fits right into our philosophy, which is the lowest dose possible to help control your particular challenge, and also utilizing the nutraceuticals. So one of the things that we've used in our clinic is something called LDN. And LDN, everybody knows about naltrexone, right, John? Because my goodness, there's been a big push that you have to arm the police and the paramedics and everything. Why? For opioid reversal. Well, it's interesting because for the last 10 years, there's been a push in alternative practices and alternative clinics all over the world, actually, not just in the U.S., about the use of naltrexone in a low-dose manner. And the thing about naltrexone is that we've actually coined the phrase, meaning scientists and physicians who've used this, we call it LDN. And do I use it in our clinic? Of course I do. But I use it very novelly. In other words, it's a novel approach for pain and for certain conditions. And we use it in conjunction with many of my protocols, specifically anti-inflammatory protocols. So you would think I would use it for what? Fibromyalgia, Crohn's disease, MS, complex pain disorders, and other autoimmune diseases. And in doing so, what we found, and again, I've been involved with LDN probably for the last 5 or 7 years, and I'm a member of the LDN Trust, it's called, which is a group of scientists, patients, and physicians who have helped develop some of the protocols of the use of oral LDN. That being said, we're talking about a subclinical dose. When you use Narcan, you're using doses of 150 milligrams. That's a high dose, 150 to 300, depending on how many opioids these particular patients have ingested and they're, in comatose states. So, but we're talking about dosing from 0.5 to 4.5 milligrams. You see the difference?
Yes.
Right? And we're also using this with our high-dose vitamin C protocols, particular anti-inflammatory protocols, in particular using them with things like the cytokines I talk about. And to refresh people's memories about cytokines, they're the messengers between the cells. The cytokines are proteins, they're glycoproteins that tell the cells to turn on, turn off, that kind of thing. And I found using tincture of LDN along with IVC, along with various other components in my proprietary blends, using this for things like cancer protocols and rheumatoid protocols. And how do I know they're working? Well, I know they're working based on the qualitative data that I get back from my patients.
It's kind of like you read my mind.
Okay.
Because you said, how do I know that was my next question. Like, how do you know it's working? What have patients told you after getting this treatment?
Utilizing this with their hydration treatment. Now, folks, I don't want you to think many people are saying they're prescribers of LDN, and they are, but they aren't using it the way we're using it. I mean, I've had this thing compounded for us in so many different forms. You just wouldn't believe it, because I have patients who can't take the tincture, patients who didn't want it, said that it interfered with their sleeping. That was probably the only side effect I ever heard, because you have to take this because it works on your own growth factors, OGF. This thing was founded way back in early 90s by a scientist at Penn State. And I actually contacted that scientist way back then because I was so interested in his work. And I wanted to say, what application could we use this LDN, and how would I weave it into our protocols? And I got to tell you, since that time, I've been using it, and I've been using it with our protocols. And I do believe that we can intensify this antagonistic effect, which is what it does. It's an antagonist. We can actually intensify this by using other anti-inflammatories in the hydration.
So, as you have always done, you kind of develop things, your own protocols, because you're a scientist by nature.
Right.
And so that's what you do.
I love the challenge.
That's what
I
you
love
do.
the challenge, right?
And so do you see, obviously continuing to use this, and will you potentially see it being used in other conditions down the line, other challenges?
I see us using, well, right now I'm using it in the cancer patients. There's some small data showing that it turns off the growth of some of the tumor. I'm reading it. It comes out of England. The interesting thing is the body of the evidence for this came over to us from England. And I got to tell you, because they don't have the restraints that we have here in this country, they're able to do small studies showing how to apply these things in a way that works. I want to say to people, this is not the only thing I use in subclinical doses, but this is something that I have been out promoting because, again, I'm a member of the LDN Trust. And I really believe that the action of the LDN, along with, in conjunction with the hydration therapies that tends to intensify this, starts the cell communication. And I got to tell you, it's amazing results. I have several patients with Crohn's disease that I'm using it on, that were told the next step for them would to be surgical intervention and remove part of the colon. I got to tell you, I have one young man who actually works for Blue Cross of PA, Independence, who is doing so well, he can't even believe it. He said, I was going to the big man in the game, and until I came to your clinic and spoke to you and your docs, I thought I was going to lose a part of my colon. He said, and I've got to tell you, for 5 years now, he's been absolutely doing extremely well.
So you're talking about this particular LDN.
Yes.
Like we talk about in other situations. How often do you come in? How many treatments do you get?
Well, listen, we're talking about people doing hydration therapy, which is a course of treatment between 10 and 30 treatments, and then also utilizing the tincture that I give you, along with some other things like changes of diet, that kind of thing. You can't, look, yes, people want to say, well, let me just go get it. Because I've had people called up and said, I just want the LDN. I'm sorry, I don't operate that way. I'm not going to give you a piece of the puzzle. That's not the entire picture. I want to look at many of the underlying causes. And I know that LDN will suppress some of the pain. I want to get you on that as quickly as I can. But I also have to prepare your cells to stop the inflammatory process. That's what I want to do, thereby improving your entire quality of life.
So you can't just come in and say, "Hey, Dr. Molly,
give me some LDN."
Give me some LDN, right?
No. First of all, we're gonna look at the underlying conditions, and that's what I want to do. I mean, to me, it's not enough to use a treatment for chronic conditions or chronic pain alone. You want to find out what some of the underlying things are. And I'm very big on the fact, like my MS patients are on this, and they're doing really well. And I'm telling you, because I sit down with other scientists who just prescribe the stuff, and they go, well, how are you getting these kinds of results? I said, well, because I believe that the hydration therapies that I use, and they're proprietary.
Yes.
The hydration therapies along with this LDN is what's causing the rapid turnaround in pain, inflammation, etc.
What about arthritis? Is that something?
Oh, man, yes. Yeah. Yes, absolutely. Now, the interesting thing is the other reason why I just don't want to say, here's a prescription, go get it, done. No, because I also want to hear from the patient, because there is a range in this LDN, in other words, 0.5 to 4.5. And many times you have to go up, many times you have to go down, because the body, the antagonist, is so brilliant. It goes to certain receptors, fills the receptors, but guess what? The body then says, do I want to make more or do I want to make less? So that's a question of discussing it with us, meaning myself and my doc, discussing it with us, and we'll tell you how to use it, because it's always in flux. Why? Our bodies are always in flux, John.
Makes sense. All right, we're coming up on our final break of the morning, which means you still have time to jump in with a question or a comment for Dr. Molly. And again, the number here in the studio, 855-839-1210, 855-839-1210. Our show is called Health Watch. You'll find us here every Sunday, 8 till 9, the live version on Talk Radio 1210, WPH.D. And again, the number here, if you have a question for Dr. Molly, 855-839-1210. With Dr. Molly Fantasia, the Ph.D. doctor, executive director, and founder of Innovative Medical Associates. I'm John DeMasi, coming back with more Health Watch after these words. As we always say here on the show, operators standing by at Innovative Medical, and just because we leave you at 9 o'clock doesn't mean they leave. No, they're there all day, so you can call them at any time. But if you can call right now, go ahead. 856-489-0505. That's the number. It's Innovative Medical Associates, Marlton, New Jersey, 856-489-0505. And remember, the website is innovativemedicalassociates.com, innovativemedicalassociates.com. And we should also remind you that this particular program is here live from 8 until 9, but we have our Health Watch replay. Sometimes we call it the sleeper special because people say, John, Dr. Molly, we don't get up until well past 9 o'clock on Sunday. Well, then you can listen to us from 4 until 5. It's our Health Watch replay every Sunday here on Talk Radio 1210 WPH.D. A couple of minutes left of the show. If you want to ask a question to Dr. Molly or you have a medical challenge, 855-839-1210, 855-839-1210. Dr. Molly, we're going to kind of tie in one of your patients, Sandy, who also has arthritis and many other
Autoimmune,
challenges,
yeah.
autoimmune,
Yeah,
and she's being treated with the LDN. So
Of
let's
course she is.
talk about that a
But,
little bit.
you know, she's also being treated. In fact, is part of the treatment protocol. She comes in and she has her hydration IV, which also includes many of the anti-inflammatories, certain particular cytokines, again, because her condition is pretty severe. I mean, you know, she has a tremendous autoimmune response to joint pain and everything. If you see her, it's unbelievable. But you notice she gets in there. She's actually gotten a facial, which she
Yes.
said has helped my mental state. But also, she gets up and around. Sure, she's a little slower than she was 20 years ago, but she's still going strong. And interestingly enough, about 4 weeks ago, Dr. Mark and I did a PRP, a certain injection, as well into her knees in order to help support the knee cartilage, etc. And I would tell you that I believe after the PRP, she had very little pain from the injection itself. That's related to the LDN and our treatment protocol. And she came in and she said, somehow I'm feeling so much less pain in my joints this past few weeks, Ma. What have you done? I said, well, I've switched up a few of the nutraceuticals to enhance the outcome of the stem cell treatment, which also included the PRP, and stem cells in her knees, which are really cytokines, or the mixture of the extra fluid outside the cell, which enhances communication. So technically, it's not a stem cell. So I want to make that clear, but it's a mixture of the things that make up the communications, and in there may be a few stem cells. So what happened is she said, I don't know what you did, but it was post that I started to feel better. I said, it's really in the hydration protocol that's working for you. She said, well, I'll tell you this, I don't miss a week, and she doesn't. This has been true for at least 10 years, 15 years.
You know, we should mention, and you've often said this, I know you tweak the hydration protocols quite often because I feel it sometimes. I'll say to you later on, I said, did you do anything? Oh, yeah, I switched this, I did that, because you can feel some kind of difference.
Right.
So it's not the same old every week, right?
No, because I want to hear back from you. That's why you'll notice I come out on the floor.
Yes.
Right?
Yes.
I want to talk to you because most people are there. They're coming back the following week or they're coming in another time this week.
Right.
And it's during that period of time where I can get the information. Now, folks, don't beat me up about HIPAA. I have permission from all my patients to talk to them while they're getting their hydration. And I can tell you that indeed, that's how we are able to get together and talk, the practitioners talk about what else we need to do for them. For example, we might need to switch up the vitamin C, the extract of vitamin C, because this week we've got to handle not just your cancer, but something else that's going on.
So it evolves.
It evolves week to week, program to program. You need to make sure that you get in enough of these treatments to continue the reserve and to actually effectuate the change in your quality of life that we're looking for. So it isn't like, oh, look, it's not a drunk tank. Come on in, let me give you a banana bag and be done with it.
Yeah, that's not what you do.
Not at all. There's a true component of science here, and it takes time. It takes my dialogue with patients. It takes my dialogue back with my doctor. It takes all of this so that we can then enhance a patient outcome.
We should mention also, you said you come out into the clinic and you talk to patients, and you also, I got scolded this week.
Yeah, sure.
because you noticed
nice
something.
way.
Yeah, in a nice way. You and Nurse Barbara, by the way,
Yeah, that's
said,
right.
well, you better clean up your act. So
Right.
I got to make some changes. But
Right.
you're always, I guess, monitoring patients.
Sure, we have blood work we're doing. We'll send out for radiology. I want to get the reports from the surgical interventions. I just got a referral this week, actually over the weekend. I haven't met the patient yet or the potential patient from one of our surgeons who is a breast surgeon. She's not one of my surgeons. She's an independent person, as you say, but I know her, and it's a referral from her, and it's a reoccurring breast cancer in a 34-year-old. So all weekend I've been up about this because I'm anxious to see what the pathology reports are, et cetera, and see how we can actually put a program together for this gal and really help her through this journey.
Speaking of cancer, we should mention before we leave this morning that you have a lot of patients in the cancer protocol.
Right.
And for those who may be suffering from that, who aren't aware of it, just briefly give us an idea of what you can do to help people.
Well, we want to
who are
help
going
people
through cancer.
we want to help you get through your traditional treatments. So if you're in chemotherapy, we're not going to give you anything to interfere with the chemotherapy. If you're post-surgery, we want to get you back on your feet rather quickly, but always with the understanding that we want to aid you through your cancer journey. You know, cancer's a journey. And as of right now, really, you know, we have all these new drugs out. We have everything out. But you know what we want to do? We want to enhance your quality of life through this so you can take those new drugs, so that you can take the immunotherapies. And we want to get you to the other side of that with the help of the good Lord. So
Back to square one, as we were saying before, building up your immune system.
that's right. That's right. Building up your immune system, keeping the anti-inflammatory process going, having the cells start to communicate a little better. The messenger cytokines communicate and change the dysregulation that's going on. You got to understand that in the end, everything is related to cellular communication and the regulation of this. God's created a beautiful thing. He's created a beautiful body that works in harmony, and each and every system works in harmony. And when one of the systems is thrown off, you got dysregulation, and that's something we want to continue to address in our clinic.
All right, before we leave, this is kind of an overview question. If people made a resolution to get healthy for the new year, what would you suggest they do
Come
first?
on in for the free consult. I'm available from Monday to Thursday, and I will try to meet with you around your schedule. And I would tell you, come in while my patients are there. Start talking to them. You'd be surprised. The human condition is universal, and you'd be surprised how you meet people who have similar conditions to you. And I believe we can help. That's the bottom line.
Guess what? We're out of time.
Oh, my gosh.
Well, that's going to put the wraps on another edition of Health Watch. Don't forget, operators are standing by, and they'll be there well after we leave you at 9 o'clock this morning at Innovative Medical, 856-489-0505, 856-489-0505. Also, the website, innovativemedicalassociates.com, innovativemedicalassociates.com. And don't forget, if you missed any of today's show or you want to hear it again, we have our Health Watch replay this afternoon, 4 till 5, here on Talk Radio 1210 WPHT. For Dr. Molly Fantasia and everyone at Innovative Medical Associates, the lovely Linda, Barbara, Delightful D, Joanne, Fabulous Fran, our nurses, Jess and Lana, and Caring Kathy.
Oh, yes.
All right. Can't forget her. No. I'm John DeMasi. Thanks for listening. Have a great week and a healthy one. Talk to you next Sunday, 8 till 9, Health Watch, Talk Radio 1210, WPHT. Take care.